Parents should avoid comments on a child's weight. Should parents talk to an overweight child about weight? Or should they just keep their mouths shut? Parents in this situation are understandably torn. Say something, and they risk shaming a child or worse, triggering an eating disorder. Say nothing, and they worry they're missing an opportunity to help their child with what could become a serious long-term health problem. Now a new study offers some guidance: don't make comments about a child's weight. The study, published in the journal Eating and Weight Disorders, is one of many finding that parents' careless, though usually well-meaning, comments about a child's weight are often predictors of unhealthy dieting behaviors, binge eating and other eating disorders, and may inadvertently reinforce negative stereotypes about weight that children internalize. A parent's comments on a daughter's weight can have repercussions for years afterward, contributing to a young woman's chronic dissatisfaction with her body, even if she is not overweight. Parents who have a child who's identified as having obesity may be worried, but the way those concerns are discussed and communicated can be really damaging, said Rebecca Paul, Deputy Director of the Rudd Center for Food Policy and Obesity at the University of Connecticut. The longitudinal research shows it can have a lasting impact. The impact on girls may be especially destructive, she said, because girls are exposed to so many messages about thinness and body weight, and oftentimes women's value is closely linked to their appearance. If parents don't challenge those messages, they can be internalized. The new study included over 500 women in their 20s and early 30s who were asked questions about their body image and also asked to recall how often their parents commented about their weight. Whether the young women were overweight or not, those who recalled parents' comments were much more likely to think they needed to lose 10 or 20 pounds, even when they weren't overweight. The study's lead author, Dr. Brian Wanzink, a professor and the director of Cornell University's Food and Brand Lab, characterized the parents' critical comments as having a scarring influence. We asked the women to recall how frequently parents commented, but the telling thing was that if they recalled it happening at all, it had as bad an influence as if it happened all the time, said Dr. Wanzink, author of the book Slim by Design. A few comments were the same as commenting all the time. It seems to make a profound impression. Some studies have actually linked parents' critical comments to an increased risk of obesity. One large government-funded study that followed thousands of 10-year-old girls found that, at the start of the study, nearly 60% of the girls said someone, a parent, sibling, teacher or peer, had told them they were too fat. By age 19, those who had been labeled too fat were more likely to be obese, regardless of whether they were heavy at age 10 or not.